have someone here to assist me with the station as well, and I'm ready to begin. I've taken BSI precautions. I'm determining scene safety. I'm considering nature of illness or mechanism of injury. This sounds like a nature of illness type of call. I'm determining the number of patients. I see one patient. Okay. I'm going to go ahead and call for advanced life support at this stage because of the age of the patient and the chief complaint of chest pain and difficulty breathing. I would like to get a paramedic en route to my scene, and I'm also going to consider possible spinal injury. How you doing? My name's Mark with ABC Ambulance. What's going on today, my friend?
I have pain.
You have pain?
Chest.
Okay, okay. You didn't fall or hit your head or anything? You're not having pain in your neck or back right now?
Nope.
Because I'm considering possible spinal injury, and they'll say noted, ruled out. Right now I have a poor general impression because my patient is having some chest pain and difficulty breathing at 68 years old. Airway, breathing, and circulation are intact right now because he's speaking to me. So I want to go ahead and check his heart rate right now. Okay, and I'll be checking his heart rate. And while I'm doing this, I'm going to get a quick respiratory rate as well. And they're going to give you the values as you ask, all right? And I'm also going to check skin color, temperature, and look for any serious external bleeding that may need to be controlled immediately. I will now direct my partner to place a non-rebreathing mask on the patient. So my partner's going to put an oxygen mask on to see if this doesn't help you out a little bit, okay? My patient is most assuredly a high priority. The chief complaint here is chest pain and difficulty breathing. Right now, I'm thinking possible cardiac event. So I'm going to speed this process up a little bit and get my interview going. While I'm interviewing my patient, I'm going to direct my partner to obtain baseline vital signs to include blood pressure, pupillary reaction, skin color, skin temperature again. And we're going to go ahead and recheck the heart rate and respiratory rate. Hey, when did you start having chest pain? When did you start having this problem?
When did I start having it? It's about 20 minutes.
Outstanding. Does anything make it better or worse? Any change in position or anything? Anything better or worse?
No.
No? Okay. Describe. I'm sorry, I can't talk. My knee's killing me. I'm old.
Let me start there.
No, I used to be somebody, man. Give me a moment. Describe your pain to me. What does it feel like?
It feels like there's an elephant sitting on my chest.
Okay. And are you having pain anywhere else in your body right now?
My shoulder or my arm.
All right. And just point to that pain in your chest again. Where is it?
Here.
And on a scale of 1 to 10, 1 being not bad, 10 being terrible, would you rate this pain?
10.
It's a 10. Okay. Is the pain constant, intermittent? Does it go away at all?
It's constant.
Has this ever happened to you before?
Yes. About 2 years ago, I had an angina. They gave me what was that? Heart pills.
Okay. Have you taken anything, any medications, any of those heart pills? Have you taken aspirin, anything prior to our?
No.
Okay. Signs and symptoms: he's ashen, he's clammy, he's having shortness of breath, he's guarding his chest, the Levin sign. Are you allergic to anything?
No.
Do you take any medications besides the heart pills?
Nope.
When, do you have a past medical history I should know about besides the cardiac issue?
No.
When's the last time you ate or drank something?
2 hours ago.
And what were you doing when you started having this pain?
Watching TV.
You're watching TV? Okay, what I want to do right now is get his nitro and contact medical control and gather baseline vitals from my partner. I want to contact medical control and let them know that I have a 68-year-old male with a cardiac history that is currently having chest pain. That's a 10. And that he's having shortness of breath. He has been prescribed nitro and has not taken any nitro at this time. I've inspected the nitro to make sure that it meets the rule of the R's, that it is in fact the right patient, the right medication, the right dose, the right route of delivery, a non-expired date, and in fact the right time to deliver it. His vital signs, respirations are 22 and labored. Blood pressure is 150/90. Heart rate is 90 and irregular. And I'd also go ahead and do a focused exam and quickly listen to lung sounds, and will report that lung sounds are clear and equal bilaterally. I'd like permission to deliver 3 sublingual nitro 5 minutes apart, provided the systolic blood pressure remains 100 or better. Dr. Boombot says, okay, EMT Mark, you may deliver 3 sublingual nitro, 5 minutes apart, provided systolic blood pressure is 100 or better. And this is where Kyle mentioned we do the echo communication. Understood, Dr. Boombox. That's 3 sublingual nitro, 5 minutes apart, provided the systolic is 100 or better. Sir, I think you might possibly be having some trouble with your heart again. We want to go ahead and give you some of your medication and get you down to the hospital pretty quick here and get you looked at, see if we can't get you feeling better, all right? Would that be okay with you?
Mm-hmm.
All right, I'm going to go ahead and take the nitro tablet in my gloved hand. I'm going to place this under your tongue. Please do not chew it or swallow it, all right? And we put it underneath. I'm going to go ahead and quickly document what I delivered, the route and time of delivery. You may experience some burning or tingling under your tongue. You may even get a headache. This is, in fact, a side effect of the medication. I will follow this in about 5 minutes with another set of vitals, but right now, I would like to get this patient packaged up as he is a high priority and onto my stretcher. On the ambulance stretcher, I'm going to position him sitting up in position of comfort, then transfer to the back of the ambulance and start getting him en route to the hospital, priority transport. In the back of the ambulance, I would reconsider the nature of illness. I would reevaluate my initial assessment, keeping a close eye on his mental status and ABCs. I would also check his vitals every 5 minutes because he is a priority patient. I'm going to go ahead and reconsider my transport decision. He does remain high priority right now. I will check my interventions. This includes making sure the high flow oxygen is appropriate for him and is being delivered in an appropriate manner. He's getting good adequate rise and fall of the chest, good ventilation. I'm going to go ahead and keep a close eye on the blood pressure, and as needed, deliver up to 2 more nitro for a total of 3 5 minutes apart. Again, as I said, provided systolic is 100 or better. I will observe this patient for changes in conditions. My clinical impression of this patient is a possible cardiac event, history of angina. My treatment for this patient is through. Do you have any questions?